Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and today we're going to talk about, at least for now, the last in the series of the Baumholtz Talks Botched surgery, where we talk about facility factors as they pertain to the perception of bad outcomes or botched surgery and those kinds of things. So first and foremost, right, we've picked an appropriate surgeon, we've picked an appropriate surgery, and now we're going to discuss or learn or want to know more about the facility where the procedure is going to happen. All right, so in the United States, here are your options. You can have surgery in a doctor's office, right? If anesthesia is going to be used, that facility needs to be certified. The most common certifying body for office operating rooms is what we would call the Quad A SF. AAAASF, and so you'll look for that certification if it's going to be done in an office setting. It could be done in an ambulatory surgery center or what's called an ASC. These are outpatient surgery centers, typically certifying up to hospital level standards, but they typically don't have overnight capabilities. Some ASCs, before the comments start, some ASCs do have 23-hour observation things. You can stay overnight, but it is not the same thing as a hospital. And then, of course, the next step would be doing a surgery in a full-scale hospital. Now, which one is right for you? This will depend on your health status, the extent of the operation, how invasive the operation is, what the surgeon's comfort level is, what their relationship is with the different facilities, and whether or not they have their own operating room in their office. One is not inherently better or worse for you without understanding what the you is. In other words, if I have someone that is maybe older, maybe a little sicker, maybe they come from far away, the best choice may be, for me at least, a facility where we can have an overnight stay. Something which could be done reliably and safely can often be done in an office setting as long as the appropriate safety nets are in place. Okay, so now we get to the next part, the safety nets. So for me, safety nets are really important, right? I will say repeatedly that complications can and do happen, and the only surgeons that don't have complications lie or they don't do enough surgery. So if we assume going into this that plastic surgery is a full contact sport, let's put all of the safety nets underneath you and I when we go to the operating room. For me, that means we're going to do surgery at a fully credentialed facility, and we're going to have a board-certified anesthesiologist who is charged with taking care of you, the patient, right? That's not to say anything negative about the many men and women who are nurse anesthetists. It is my preference to do operations with an anesthesiologist. What we know in plastic surgery is that we are often the first surgery for many, many people, and in plastic surgery we have the good fortune, I guess you might say, of uncovering previously undiagnosed health issues in a lot of patients. And so knowing that's the field that I'm in, I'd like to have as many safety nets underneath all of us as possible. And that's one of the reasons, by the way, that in our practice, we will very frequently ask for medical clearance from your doctor. We'll make sure all your standard routine screenings are up to date. So if you're a woman and you're of the age where you are in mammogram territory, we're going to want to make sure that you have an updated mammogram. Same thing with colonoscopy. And you may say, what does that have to do with my surgery? Well, it's just my personal belief that I don't want to put you through a big, potentially expensive elective operation only to find out, God forbid, there was something that was missed or that should have been known beforehand if you were up to date on your routine screenings. Back to the facility, based on your health issues and needs, we may need the full resources of a hospital, we may not. But what I would encourage you to do is when you're considering plastic surgery would be to talk to your surgeon about where the surgery will take place, what safety nets are available at that facility, who will be providing the anesthesia, and how does that facility respond to complications. In other words, what can that facility offer you if, God forbid, there's an issue. Those are the main topics in the facility section of this multi-stage botched talk. I hope this was helpful to you. If you'd like to know more, please contact us. And if you'd like to know more in this series, please make some suggestions, and I'm happy to record some videos. Have a great day.